Winspiration, the way to the essential. On UK Health Radio, Winspiration brings wisdom and information for an extraordinary future. Together, we can shape the world we want to live in. So let's get real and create the idea. Be extraordinary.
Welcome to another episode of Winspiration, giving you insights to create a better future for yourself or the thriving society. And the last sessions we talked sometimes about the COVID problematic, and the last episode you heard about protein engineer, what went maybe all wrong. And more, it is officially acceptable that vaccinations maybe cause problems. So whatever it is, if it's just a normal long COVID or problems after vaccination, if it is like this, is there a chance how to handle all these sicknesses and so what comes and really painful experiences out of it? And that's the topic of today. And once again, thank you, Stefanie Merse. She's a doctor in Germany and is very interested in helping also in the natural way and connecting people to see the light at the end of the tunnel, what to do. And today we have the special guest also, Dr. Jaeger, and she is expert of it. She is the boss of a clinic, so she has really also a responsible position, but she is also, and I need to say it right, especially in the English version, maybe it's an English saying, word, and it's just a kind of cleaning of blood and everything. And she, for years, already involved in seeing problems with COVID and what can be the solutions there. So in this session, we want to avoid all the strange topics with COVID, but mainly focus on what we know today, how we can best help people who are suffering from long COVID or problems after the vaccination. So welcome again, Stefanie, and especially also today, Dr. Beate Jaeger. So if I didn't say something not super correctly, please feel free to add and share. Otherwise, I will ask Dr. Jaeger, if you please share your experience. What made you focus on this, and what is your experience in helping COVID patients?
Well, first of all, I would love to thank you for the kind invitation. Wolfgang Sonnenburg, that is a great pleasure to speak today to a broader audience, especially in the British area. And I would like to say I was working many years before with extracorporeal devices, as my postdoc specialty was in Munich University, organized to do something to improve the survival of cardiac transplant recipients. And the so-called HELP apheresis we were studying in these days stands for heparin-mediated extracorporeal LDL precipitation. And quickly explained, it is a device that looks similar to a hemodialysis machine, but it does not operate especially to improve kidney function, but it works on improving the whole vascular system by depriving the blood from harmful substances like toxins, like cytokines, cholesterol, and clotting factors, as well as other inflammatory mediators. And this treatment, although not very well known, is established in Germany since now almost 40 years. It was invented by Dietrich Seidel and Eberhard Wieland, who tried to help in the early 80s children with inborn cholesterol genetic errors who face myocardial infarctions during childhood. And they brought this technique into an application together with the company B. Braun in Melsungen, Germany. So, and since then, hundreds, thousands of treatments have been performed, especially in patients who experience repeated stent occlusions or trouble after CABG operations, or have severe atherosclerosis or peripheral limb disease. So it's it puts away the patex of the vessels in reducing the fibrinogen concentration of the blood within 2 hours by 60%. This means you have a drastic impact on the entire rheologic system, especially on the microcirculation. So we published earlier that the day after the apheresis, your resting cardiac perfusion is still 20% better. The same is true for the brain, the lungs, and other inner organs, but also for peripheral, small and large vessels, which gave reason to use this treatment as a kind of ultima ratio treatment, last resort treatment for desperate cardiac patients or patients with cardiovascular problems. So by working in this field, I was running this unit at the University of Munich, later at the University of Essen, and then I made my own little place in Mülheim first. And as stated earlier, I have had a personal relationship with doctors from Wuhan and from Beijing during my studies in Essen. So when all the story about COVID began to start, and I had seen the first pictures on television of the drama in the hospitals, I was thinking this is very quickly turn out to be a global problem. And then I tried to get more information, to read more, to inform myself better. And then I think it was if I remember right, in March 2020, there was a very good publication from the pathologist Susanne Varga from University of Zurich, Switzerland. And she had demonstrated very clearly that the COVID infection was causing a generalized endotheliitis. Endotheliitis, to be explained for the greater audience, means an inflammation of the vessels of the body, not restricted to arteries or to veins, but also including the microcirculation. And they also showed that there's a large storm of cytokines, which are inflammatory mediators, released within the settings, and the lungs turned out to be milky glass open. And so this was very, for me then, very clear that it should be tried to apply the HELP apheresis procedure to endangered patients because of its extracorporeal approach, which can help the entire circulation. So I tried to publish this. I did publish this, but I couldn't get hold of intensive care patients. So I could only, in my setting, Otherwise, I would have killed my own heart sick patients. I could only start in February 21 to treat the first long COVID patients. And these were two young caretakers. One was 30 years old. The other one was, if I remember right, 24 years old. Both were completely healthy before they had acquired COVID. And then while being on duty on their wards, and they were struggling after months to come back to work. They couldn't run, they couldn't make sports, they were short of breath, they had brain fog, they had POTS, all the known complicated symptoms. And then I treated them, one with 3 apheresis treatments, the other was 2 apheresis treatments within 1 week, and both were fully recovered very, very quickly. I remember the first one called me. He had a little asthma. He had an asthma spray to overcome the day. And after the second treatment, he forgot to take his asthma spray and started jogging. And he was a marathon running guy. And so this was very obvious and very time related to this treatment. And then the third patient was a young architect who had suffered already a stroke at age 32, who also massively improved after the treatment. And then I experienced a kind of being overrun by patients because the new digital media made a mouse-to-mouse propaganda, and I couldn't look so far as many patients entered my office. And then I had another, for me, very scary experience. I had a physiotherapist lady, and we were putting needles into her veins, but there was no blood flow at all. So I was forced to pull the needle out, and I had a 12 centimeter long clot at the needle. And I had to put it away and touched it with my gloves. And it was like caoutchouc. It was strange, not like a normal clot. And then I realized more in detail there's something that is very spooky about the clotting system, because you can see this also in heart transplanted or other heart patients, but not with this extent, and you would not expect it in a 30-year-old woman without any precondition of disease to experience this. So then I met the wonderful Anne McCloskey from Seattle in America. She came to visit me. And she put me into contact with many researchers from America, but also with researchers from South Africa, Resia Pretorius and Jaeger Laubcher. And and we had a Zoom meeting, and Jaeger, while working on his intensive care unit, told me that he was giving fibrinolytic agents to resolve the milky glass lesions of the lung, and he was successful. And this was an indirect proof that the lungs were not only inflamed, but they were fully clotted. So, and working with many of these brilliant researchers together, we made studies, but were not published, had troubles with ethics committees, had troubles with organization because too many patients approached us. So we are still very successful with this treatment. Over 80% improve. Not everybody improves. I have seen also some patients who did not profit, but I never saw somebody getting harmed by the treatment, and this gave me personally reason to continue my work against all criticism and whatsoever, because I had the feeling if there's a fire, we have to behave like a fireman and first pull the water out and then write poems about it or something else.
Yeah. Oh, thank you for these, and was an introduction and getting the story. And I think it's also a general topic that we're focused today too much on input and not on detoxification. What do we eat? But we forget to detox. We're thinking vaccination, but not what we do afterwards. And then for me also the interesting part is I have a unique fingerprint. I have a unique digestion system. So everything is microbiome system. Everything is unique. Why can someone come up and say also, oh, we have one stuff for vaccination and that fits for all? Just these kind of thinking already is a little bit, kind of strange for me, because we're so careful with the car. Do we put diesel in or whatever? This is good for the engine. So I think also then if something wrong is in or not working, we need to have a lot of focus on the detoxing. And when we talked earlier, pre-recording calling, you said also the main topic is also we don't know how to get the spikes out of the body. So
yes,
of just cleaning the blood is one way, but if I understand it right, it's mainly about the blood, but the spikes can be everywhere.
Yes, and it's of course already proven. So in the first wave, it was mostly a cardiovascular pulmonary problem, but now with autopsies from vaccine injured people who died, we have proof that there's presence of spike proteins and viral persistence in almost every organ, in almost every tissue. And now we approach most troubles with the neuro-COVID system. So, of course, the family of the coronaviruses are long time known, and already in the 50s and 60s of the past century, there were considerations, will there be any useful vaccination for this type of virus? And the researchers by that time denied it because it was so quickly mutating. So it is a weird thing with the vaccine, and it has also a general aspect. Never before in history we made an mRNA vaccine in such extent to mankind as we did this time. And the long-term implications are not known.
So it is, in Germany, at least I know they changed the law that they allow to call it vaccination. Nobody wouldn't say that it is a vaccination.
No, it's a precursor of a gene therapy in my respect. And people who tried to warn early were badly treated. And for most people in actively participating in life and trying to fulfill their duties for their countries, they were obliged or even forced to be vaccinated. And this is, of course, ethically, retrospectively critical, although I also have some understanding for governments who have to make sometimes unwanted decisions to save the majority of the people. So I don't want to make a guilty story. Who is guilty of this? I think this is not helpful at all. But what is definitely needed is to bundle the interdisciplinary experiences of how to cope with this problem best. and there must be a way to detoxify the spike proteins out of the cells. I'm working also on natural substances because apheresis is a beautiful treatment, very successful, but very, very limited and I wish we find a solution that suits for the world and is affordable for the world.
Okay, well, that is quite often a problem in the beginning of whatever treatment. It's for a few who have access, who have the money and everything. And unfortunately, we have not, in the Western society at least, talking about them, really interest in helping the majority of the people. It's still more helping the system and not really the human beings. So it's like, I think it's gross domestic product, what I love to talk about. Oh, that is just whatever shitty invoice we write. It's wonderful and we can borrow money against it. When you just now talk, also I know Stefanie is also very interested in the nature and what kind of herbal possibilities we have, natural possibilities. What do you see? There at the horizon, or what did you experience or tested already something?
Yes, we test a lot. So first I have installed a fluorescent microscopy diagnostics, because before you give 3 blood thinners to a person you see at one consultation, you have to know what's inside the blood, what's going on there. Mm-hmm. And this is very clear. In the beginning, we saw mainly microclots of less than 1 micrometer diameter, but we also saw very early a massive platelet activation, thrombocyte platelets activation, which...
Just words that easy everybody and I better understand what you mean.
Yeah, well, it is the platelets form the clots. This is the specialized blood cell who is responsible for clotting. And they, you can depict them under the microscope in their activation status and in their clotting behavior. And we have seen massive clots and massive damage also from the inner vessel wall called the endothelium. And this is an observation which was not so prominent in the beginning. In 21, there was not that much endothelial damage. Now we even see in people who are clinically much better, able to run, to work, to go to school again, that we still see endothelial damage. So this is a scary observation.
Beginning, you couldn't see it. Now you see it. Is it because of you have different tests that you see it, or is it just because of the second or third vaccination, or what makes it that?
Well, it has different reasons. We used exactly the same method, so it's not a methodological item. It's just, I think, the key trouble. Let's come back to the origin. The key trouble that this COVID infection in those who are severely infected induces is oxygen deprivation. So this has 3 components. We see more clotting in the blood vessels. We can measure a reduced blood flow, massively reduced blood flow, which of course facilitates more clotting if the blood does not run regularly. And the third observation was pioneered by Professor Guck and Martin Krater from the Max Planck Institute of Physics in Erlangen, Germany. And they have showed for the first time that the red blood cells who give the oxygen away to the tissues are deformed and not well working. And together with them, we have observed that there are clots that do not only compose of fibrin and platelets, but also of neutrophils, of red blood cells, thrombocytes, and which form huge conglomerates which are too big to pass the diameter of a capillary. So this oxygen deprivation, which is subacute, except very massive if the patient has a massive pulmonary embolism or a myocarditis, which is an inflammation of the heart by the virus. I've seen patients who had a venous oxygen saturation of only 16%. After putting them on the health machine, this special case had 86% saturation. And she told me, wow, I can breathe again. So that is not to that extent dramatic in every case, but most of them have, because of this trias, more clotting in the blood, slow flow of the vessel, and deformed red blood cells that causes a chronic subacute ischemia, and this again damages the vessels and makes more damage over time. So that is what we were expecting to see in this year, and exactly it happens like this. Mm-hmm. So, and there's some more we can observe. There are some clusters. Not all the long COVID patients look alike. So if you just speak for the fluorescent microscopy and look at a patient's blood, you cannot distinguish, is this a vaccine-injured patient or is this a long COVID patient? Of course, we speak with the patients and we know their history, and we see much more often now the combination of both, that we were seeing patients developing 3 times COVID and were vaccinated afterwards, or were vaccinated first and then instead had COVID. So this makes this clinical appearance much more complicated.
Mm-hmm. I didn't get why you can't really makes a difference, because those who only got the COVID and no vaccination shouldn't have so many spikes in their body. So you...
Yeah, important question. Under the fluorescent microscopic setting we use, we have a 60-fold amplification of the blood. In this amplification, you cannot recognize the spike protein. It's too small. You can just look at the blood cells and their behavior. That's this level. Now we are implementing spike staining of cells in the blood. This is starting, but not available in all labs. And of course, you can distinguish according to the antibody levels, whether they have nucleocapsid antibodies or not. So this is not the problem. You can distinguish this, but we want to see the momentum before we start treating a patient. And first we start to give him aspirin at a baby dose like a heart patient. If he's not a child, then we give beta clopidogrel. But we intensify care and we give help apheresis only to our worst cases. So I've seen very good, like many of my colleagues now worldwide, I have seen very good improvements of patients who were taking for 3 to 6 months just 3 blood thinners in various combinations. And this is of course, an off-label treatment so far, and it's not without danger, but outweighing the benefits, I could experience, at least in my patients, that the benefit is much greater than the harm, and I could get people out of wheelchairs, and this is a direction which has to be focused on in greater studies. I'm not able to do in my setting, and I'm not able to finance. And as these drugs are old and already on the market, there is no interest from the pharmaceutical companies to sponsor expensive studies. I can understand this from an economic point, but it would be much better to find out which combination is most efficient, and this will help many of these patients. And only the worst cases then probably they need extracorporeal treatment. One other focus is that we see mast cell activation. Mast cells contain most of the endogenous heparin, and they are repair cells. They go at that site of damage and repair, and they can release histamine, and many of the patients develop a kind of histamine intolerance, which means they cannot eat cheese anymore, they cannot tolerate wine, they don't like tomatoes, many other issues contain that. And so antihistaminic treatment can be very helpful in this regard.
Winter said the blood flow is, or the blood is thicker. How important is water, the quality of water, or the amount of water to support the blood flow? Maybe Stefanie, you have an idea with this, because you're so much in alternative treatments as well. Shaking the head means no influence. Okay, let me ask this kind of question.
Yeah, I think I can say something about it, because many of these patients also develop venous troubles. So and the so-called POTS symptoms, which means if they stand up from sitting, their heart rate increases sky high. So if you stand up, you will not feel a difference in your heart rate if you are trained, and even a not trained person will not feel a difference. But if you sit and have a resting pulse rate of 60 and you stand up and your heart beat goes up to 200 per second, then you have a problem and you feel dizzy. And this is one of the very ugly symptoms these patients have to suffer. So many of them wear compression stockings to regulate their water balance better. So, and this is one aspect of the water. And I've seen also that infusions with just saline or other minerals were helpful in patients to reduce their dizziness, to reduce this kind of symptoms, which also have a nerval component, because the central vagus nerve, which is controlling our inner organs very much, is inflamed. So many of these patients do successfully pacing. So they put little clips of pacing systems on their ears, and a certain wavelength is helpful to calm down the vagal nerve. So there's a lot of things together with water. So I think the quality of water you drink every day is very important for your health. And I think that, and this is more a global development. If you just look 200 years backwards in history, there was no anti-baby pill. There was no polypharmacologic treatment. And of course, this is recycled in the system. And so we are facing microplastic, much other toxins that were not present, and we were not constipated for this. So there are a lot of secondary effects which make your point, Wolfgang, detoxification so important. And many people forget to detoxify the skin, because the skin is our biggest surface in the outer score. And the second very huge surface, our inner surface, are our intestines. And in this regard, it is very important to mention the work of Carlo Brogna from Salerno, Italy. He was the first who detected that COVID could act as a bacteriophage, which means it is directly infecting the bacteria in our intestines and also in our pulmonary system, and makes them produce conotoxins. Conotoxins are highly toxic and make brain fog. So it might be very, very helpful in the setting of long COVID or vaccine-injured COVID to detoxify the guts. But I will not give here a general recommendation, because it has to be accompanied by a specialist. It's not so easy to find so better make an analysis of the stools, which are the dominating bacteria you have, and which are the ones that should be individually supplemented, or the stools transplantation can sometimes be helpful. That's a very important aspect to get a better healing of the patient.
Well, yeah. Yes, Stefanie.
Bertie, you mentioned the quality of the water. It's a very important aspect. We have to look what quality of water we drink. And in some areas, the water of the water tap has more Rückstände, more parts of residues of antibiotics, painkillers, and hormones. Not only the anti-baby pill, the thyroid hormones too. And with the food, with a lot of meat, which is grown very quickly, we get a lot of hormones again. And if you look, what do you drink and what do you eat? It's one aspect.
Well, I'm convinced that my smoking habit saved me, because the nicotine in the cigarette is a strong antiviral agent. And many of the patients now take nicotine plasters in order to get relief from their symptoms. But there's one other aspect I would love to throw into this discussion, because I think it's really clinically relevant. What we saw, and which what is important, is that among the patients with long COVID or vaccine-damaged injuries, we see reactivation of other dormant viruses. So I've seen a reactivation of Epstein-Barr virus, of herpes viruses of all kind, of varicella zoster viruses, and also of other opportunistic infections like Candida infections. And both of you might remember the terrible, horrible pictures from India when 2 years ago we saw the Aspergillus reactivation in many of these poor patients. So this has a double evil aspect, because the repeated vaccination, which contains sequences of the HIV virus, weakens our immune system. And this is relevant. So the more vaccinations you give a person, the more you weaken the natural immune response. And this is in kind of future mutations we might have to fear, or other pandemics, very unhealthy, because, and I personally think the neuron elastase in the neutrophil, which are white cells of the blood, our police system of the blood, is central to this pathologic mechanism, and therefore we should not uncritically continue vaccinating people. And I personally, I can openly admit I have been vaccinating, because I was first I vaccinated myself. I didn't feel anything from the vaccination. Then I vaccinated my high-risk heart patients, but they were protected while getting continuous herpaphoresis, so nobody had a problem. But after 2 vaccinations, I saw 1 among 1,000 having myocarditis, and this made me think again, and stopping and being more careful. So it's not that, and this is a problem in the broader audience, that normal people get confused by all this. Yes, and how could it be otherwise? And also normal family doctors get confused, and they have in their daily working load, they come to their borders. And I think it's that what we all experienced in some regard. And I experienced in my clinic, half of my co-workers were COVID sick. So luckily I could help them and put them on herpaphoresis. And so that gave reason so they can work again. But in many other parts which are equally important to societies, that is not possible. So we definitely have to concentrate all our forces on helping out the problem.
You mentioned, okay, you can help it, and there are some machines, but we have not enough machines.
Yeah.
But if I just look at the countries, there is a lot of machines, but not all who have the machines have the same information and the same thinking. So I guess even at the moment, we're not using what we have fully. And when the whole COVID discussion came out, I'm not a doctor. I didn't understand everything. Is it really a virus, or is it a game? Is it just another flu? But when I saw how they treated, how governments were working on fear and everything, and like you mentioned, it's reducing the immune system, and nobody was really supporting or interesting or advertising how to strengthen an immune system, and says here is something wrong. And so if we not have now all the possibilities, what is then for those who have not access to a machine or whatever, the best way to strengthen their immune system, or what can I do if I'm on my own? And I guess Stefanie wants to say something to this.
Yeah.
Look.
It's one of our tasks to transform our knowledge from the experts to the general practitioners, not only have the same level at this moment. And it's one of our tasks to educate them, to treat their patients better. They need to understand what are the different symptoms belong to the COVID infection and which belong to the vaccination, and to get an idea. The first is listen very carefully, and you need a lot of time for a very general and complete anamnesis report.
And that is something you always were complaining, that the doctor has no time and is not really interesting in the course and just treating the symptoms. So that is a general thing what we should have.
Normally you have 8 minutes for the acute problem, the treatment, and the documentation. But the COVID patient, the long COVID and the vaccination patients need nearly 1.5 to 2 hours, because they are not so focused, and they have brain fog. They can't remember everything, and if they come with a cheat, they lost a lot of things, dropped out of their head also. And we need to be careful with them. We don't overload them. Sometimes we need 2 or 3 meetings to get the whole history.
Wow. So you say, the solution is, for sure, it's a very important point to train all the doctors, especially the family doctors. And I know for all those professionals, and we just heard it, they come to their limits because in the daily work, the day is gone already. So where do I have the time to learn the new stuff, or even the access, or do we get the idea? But what can I do if I not want to go to the doctor, or if I have not access, or on the waiting list, or whatever? The best tip to increase my immune system to prepare.
Well, I think there is something about healthy eating, healthy drinking, and of course sports, going outside, going walking or running or swimming or whatsoever. This is very important as a general prevention to strengthen the immune system in general. The next approach depends on how healthy or how sick the person is. So if people have pre-acquired autoimmune diseases or other cancer diseases, they of course should be much more cautiously than a young, healthy, strong individual. So these are the general recommendations. There is no event. I think there is now underway one very good strategy of nasal sprays to block the virus to enter the brain, because the olfactory system here allows to bypass the blood-brain barrier. So if ever you travel, and I personally also think that the flights are not safe because there are no specific filters. So I take distance, drive on your own, don't look for the big public sceneries if you are in danger as a patient. And I would, of course, take such nasal sprays, and I would look that my mineral content is that I'm not undersupplied with vitamins or minerals in general. For a healthy person, a normal food will do. You don't have to supplement everything. That's nonsense and too costly. But there are some herbal compositions which are very promising, and maybe we can talk at a little later stage when we have addressed the key protease of the virus directly, which I'm currently working on. Then we should report this. And I don't think that it is one substance. It must be a mixture of several good substances with natural anti-clotting, anti-inflammatory, anti-cancer, and anti-Alzheimer effects. Because one part we haven't touched so far in our discussion is the fact that we do not see only microclots or endothelial damage or activated platelets. We also see amyloid-like structures as seen in Alzheimer, and they are not similar. But these fibers are very difficult to be cut down, and therefore we developed the idea of combining various approaches of influencing the clotting system, but we haven't solved this problem. So we need other protein splitting effects that do not do harm on the vessel system or on the nervous system. And before I talked about the clusters I see, so some people present paralyzed, some people present with a Parkinson-like picture, some people have their main focus on brain fog and their heart inflammation. So all the subtypes, there's a big overlap also between long COVID and vaccine-injured people. It is the clinical experience I can share is that it is even more difficult to treat the vaccine-injured people than the pure long COVID patients. But this probably relates to the fact that you can find the virus in every organ system.
Mm-hmm. We just make another short break. I understand that it's everything is lately also so new, and it needs so much more studies and connection with others, bringing wisdom together. Just a simple question for me when you just said also to strengthen my immune system is, for example, doing sports, going out and running. But during the lockdowns, it says, oh, don't walk, don't do sports. And I also heard, if you have a flu or that, be careful in doing sports or things, because maybe you work on getting the virus everywhere. So was this a stupid idea, not in the lockdown to go out and walk, or is there maybe be careful when doing the sports?
Exactly. The latter is very clearly and easy to answer. If you have an acute massive flu or other viral disease, you cannot do sports. You need your strength just to fight the battle against the virus. But in the prevention, in the preventive setting, of course, sports is very, very healthy, and sports in fresh air I consider particularly healthy because it has also some aspects for the soul and the well-being, and we are not only our molecules. I personally think there's something a little more behind. But reflecting on the lockdown situation, there were many silly ideas. If I made
stop going there today, because unfortunately also the time is over. But I really love to have another session about it, because not just to point out that what was silly, that what we learned from all the ideas. And I have, unfortunately, we have only the 50 minutes here for the UK Health Radio platform, but I'll love to continue it. And so, Steffi, I saw you wanted to add something very brief, because otherwise we need out.
For the patients who suffer the chronic fatigue syndrome, it's important that they come in the moving, but very calm. We can't recommend go to the sports center and make sports, but go out and walk slowly in your area. And another point to support the oxygen level is take deep breathing. Yeah, breathe with concentration very deep in the lungs and in the body, and start to sing again. That increases that you have more oxygen in your system, and it makes you happier.
Thank you. And the breathing is nice. If you just look for other episodes here on Inspiration Radio, we had 2 with Barbara Stanze about how to breathe, right? Because this is also very important in supporting. So we had the water and the breathing. So very simple things and to take care of how you eat. But it's to be continued because we will have hopefully more and more information how to treat long COVID and all those vaccination problems. Thank you for today, Dr. Beate Jaeger and Stefanie Merse. Dr. Thank you so much for the insights, and please look around for other episodes, and we will give more information that you can have a better future for yourself. Thank you for today.
This was another episode of Winspiration, Wisdom and Information to support you getting out of illusions, false identifications, limiting beliefs. We all have the power and potential to be more, do more, have more, give more. Reality is what is possible in the universe, and the best is yet to come. If you want to dive deeper into possibilities of creating the extraordinary future, go to winspiration.global or to wolfgangsonnenburg.com. More information and some free downloads like the email program Dream Goals Reality or a copy of the book The Best Is Yet to Come can be found on the UK Health Radio website under the Listen on Demand and Presenters section. Join us again next week on the Winspiration Show for more wisdom and information to create your extraordinary future.